Thank you, Dr. Filippatos. So this was meant to be a little bit later, but in life you have to take the opportunities as they arise. So this special session is a half-an-hour session. We're talking about how to make new therapies more accessible to patients. That's why we had people from the government, from the patients, from physicians. We have from Onassis foundations. Ms. Massali, thank you for being here, and Dr. Athanassopoulos, who is also in the panel. So I think it's at this point we reached the conclusion that we have an exponential growth in the structural heart market. The structural heart disease procedure will have increased by the end of 2030 almost 3 times. It's a 20% compound annual growth rate. We have to take into account that approximately 25% of the population have moderate or severe structural heart disease. So this is about 60 million people in the United States, 40 million people, maybe going up to 72 with the increase of age of patient population in the United States. It will have atrial fibrillation. And Dr. Efremidis is here, and he will tell you that he expects to have maybe an increase a lot in an ablation that he does in the PFA procedures, as of course with this is combined by LAA closures. 1 out of 8 people 75 years and older have moderate or severe aortic stenosis. And as Dr. Mariano discussed before, maybe with the expansion of the guidelines, these patients will have to be treated sooner than later. 1 in 10, more than 75 years old, have moderate or severe mitral regurgitation, and 1 in 10, they have severe tricuspid regurgitation. So the last 15 years, and Dr. Ortan and Dr. Finkelstein also showed this data to have the exponential growth of structural heart disease. We have the TAVI, the mitral tear, the tricuspid tear, the TMVR, TTVR, LAAO, paravalvular closure. All these procedures have transformed patient therapies, but we reached to a point that the innovation gap is closing, and I think today's challenge is different, is the access gap. Can we treat? So instead of can we treat these patients, we have to ask ourselves and the minister and the health systems and the hospitals, can all eligible patients have access to the treatment? And of course, the access depends on 3 things: funding, capacity, and efficiency. So building efficient programs is very important on the issue on how to treat these patients. So on the one hand, we have the aging population. On the other hand, we have this structural heart expansion, but also everyday hospitals have to deal with workforce limitations. There are staff shortages, there is burnout, there are capacity constraints, and of course all these have to be paid now we have by the DRG bundled. There's a financial risk, and efficiency is no longer optional. So we need to find solutions, sustainable solutions that they project and they have a sustainable workflow in everyday's cath lab. So I think in Onassis we have a case example on that. So it's the tertiary heart center in Greece, small number of beds, around 120. Up until last year, where by the donation of Onassis Foundation, we have the expansion, we have additional cath labs, additional beds. But the last 4 years and 5 years, I think we would change the paradigm along with building, of course, on the previous work that have been done all these years. So we approximate have we have approximately 2,500 structural heart procedure, mainly TAVI, but also MTR, TTR, and a small LAAO, and a small number of surgical valves to tendines. And this is the TAVI program in our hospital, along with the help of people like Arik Finkelstein. So we had increased the number. We have a 10 to 15% yearly increase the last few years, and we project due to projected highest capacity to increase to around 400 cases this year. At the same time, we reached a lower 1-year mortality rate, which approximates 3%. Of course, this has to do with the lower risk patients that we are treating lately. And the pacemaker implantation rate, it hovers around 10 to 11%, and we have to keep in mind that we are mainly self-expanding center, where approximately the mid is 75% self-expanding valves. After doing a couple, then the last few years in certain patients, we managed to lower the length of stay. It's approximately 3.1 days in certain categories of patients, and total length of stay on 1.3 in the ICU. And this we did by implementing two optimization protocols, one the benchmark study, and also the FAST-TAVI, one from Edwards, one from Medtronic. So in the last few years, we had a 4-fold increase in procedures. We decreased the length of stay. That enabled us by having less and less complication to have more patients treated, and I think we managed to have better utilization of resources. So the key lesson, I think, is growth is not driven only by technology, it's driven by organization, and this should be our aim, our main focus here. And since we have our Israeli friends, and it's always nice to compare yourself to other countries with similar population. Maybe I'm not sure that they are 100% accurate, but you can appreciate that in countries that they have a similar population, like in Greece, in Israel, and in Austria, and Switzerland, around 10 million. So in Greece, you can appreciate we have a lot more centers doing TAVI. So it's very important to have a learning curve, and almost they will have the same number of structural heart centers compared to Poland. So the next frontier will be the operational excellence, of course, but also how do we reduce waiting times in lists of patients with structural heart disease, how to optimize patient pathways, how to improve resource utilization, do we monitor quality, and how to maintain sustainability of these programs. So in our center, under the guidance of the management of the hospital and with the help of Nash Foundation, we're implementing KPIs. We try to find better patient pathways along with a heart team approach, and this will serve better access, I think, for the patients. And of course, we have a patient. Also, we will have the questions from the patient association. So the patients, we need to ask patients what are the barriers to access, how do we measure value beyond the cost, and we have Dr. Nikas will answer that. And from the healthcare providers, how do we increase capacity without compromising quality, and how do we ensure that innovation reaches more patients? So in a nutshell, to put in a nutshell, the challenge is no longer to invent new therapies, it's the challenge to deliver them to the right patient in a timely fashion, in a sustainable way. So thank you very much.
John, thank you very much for your initial presentation. Are we going to open the discussion now or at the...
I think it's better at the end.
At the end.
Yeah, I mean, but I don't know. It's up to you, Michalis, because I think that what John did, he presented the data, he presented the facts, but also he asked so many questions without giving, of course, in this short introduction, the answers that I think is extremely important to discuss some of these issues. It's up to you.
Yeah, do not forget, I think the main issue of the presentation of John is that we have so many centers doing specialized procedures that it's not correct. I think that we have seen that from Israel, with the same population, with the same people as we are, they have the half of the centers doing things, procedures like TAVI or structural heart disease. I think that this is the main problem for Greece. So the next presentation is we have to see